You're listening to Catalyst for Change, and my name is Jessica Huckabee, your host. I started this podcast to learn what makes people resilient after challenging events and how they've used those series of events as a catalyst for change in their life. You'll hear stories of resiliency and strength, so get ready, sit back, and be prepared to be inspired. Today, my guest is Donald Skip Mondragon. He's a doctor and graduate of the Oral Roberts University School of Medicine and completed his residency in internal medicine in Canton, Ohio. Colonel Mondragon is a 26-year Army veteran. He spent 30 months in combat zones and is the National Veterans Wrestling Champion. So Skip became a casualty of depression and was called to advocate for men struggling with this dark disease. He now speaks and writes to combat this epidemic and is the author of Wrestling Depression Is Not For Wimps. Skip and his wife Sherry reside in Texas. Well, thank you so much, Skip, for coming on my show, Catalyst for Change, Stories of Resiliency. Can you tell me a bit about the struggles that you've had that have been a catalyst for change in your life?
Indeed, Jessica. Lights out, door locked, blinds drawn, phone turned off. I was curled up in a fetal position under my desk in my office and asking myself, Skip, what are you doing? How did you get here? And for 4 hours, I wrestled with those questions and finally admitted, Skip, you're depressed. Go get some help. April 14th, or rather April 17th, 2014. That was the turning point.
Wow. And so what did you do in order to get help? And maybe if we can start by saying what got you to that point where you were depressed?
Well, let's back up about 9-10 months before. I started struggling with insomnia. I knew that my retirement was coming up the following year in 2014. So the end of 2014, I was going to retire from the Army. And then I began to experience insomnia. That summer, there were some things going wrong with my department. I was at Eisenhower Army Medical Center, the chief of the Department of Medicine. And we had some glitches in our dialysis unit, which it was contractual. And unbeknownst to me, these things hadn't taken place that needed to happen. And that meant that our dialysis unit wasn't going to be functional.
Okay.
That meant we were going to have to out-resource some things, couldn't provide dialysis in our ICUs, etc. And this was going to have a dramatic effect on care of patients, the GME programs. And then on the heels of this, and about 6 weeks later, my cardiologist come to me and say, our lab is so antiquated, we are not going to be cannot safely do certain procedures in here. It just is not safe. And that was a double whammy.
Huge things, yeah.
Again, GME, patient care, residents from outside programs that would normally rotate with us, students that would come and rotate with us from the Uniformed Services, University of the Health Sciences, from USIS that would come. All of these things were going to come to bear. And I took this on personally, even though I couldn't do anything about it. To know this was going to happen, much less change it, I felt responsible for it. And so insomnia got worse. I would ruminate on it. I'm an empath. And so these things glob onto me. I take them home with me. And I lay in bed and ruminate. Oh my gosh, this and that. And think of worst case scenarios and felt worse and worse. And so that insomnia progressed from there. So that was the start of things in the summer of 2015.
Okay.
Okay, go ahead. Do you have a question?
No, please go on. Sorry, I didn't mean to interrupt.
Summer of 20, I believe it was September. I'd been putting off surgeries, not taking care of myself. as I should have, taken care of everybody else. And so I had delayed getting some surgeries done. I had some receding gums on my lower gums. And so I went to see the periodontist, and they said, well, best thing is we do some grafts. And the best way to do that is to take some tissue from your hard palate and graft that to your gums there, your lower gums. So we did that. Went off without a hitch there, but changed everything. Your routine, your exercise, your eating, disrupted my sleep even more. Everything was good until the first time. Then you're doing something, and then all of a sudden this spurt of warm spurt of blood you feel in your mouth. And here I sit for the next 30 minutes trying to stanch this blood.
Oh, no.
Of course, it's late at night, early in the morning when this happens. And I'm thinking there is absolutely no way I'm going to the emergency room, because they're not going to do anything for me other than what I'm doing and say, call your surgeon in the morning. And it's like, all right.
Yeah.
So I would just sit there spitting blood and holding this until it would stop, and then call my surgeon in the morning, come in, and they'd address it. So after the third time I finally went to see them, they said, all right, we're going to cauterize this. And that took care of it.
Yeah.
But with that surgery, what it did is it disrupted my exercise, because you couldn't exercise. You couldn't eat the regular diet, and it disrupted my sleep even more. So that was in September. Then fast forward. So I had that surgery. And then I had severe knee pain. So I was in very good shape, and I exercised very intensely. And what I realized in retrospect is I used that exercise to deal with my anxiety. And so in December, I started having severe knee pain, and I rarely took elevators in our hospital. We had 14 floors in that hospital. And they were large, stairwells, and I would go up those stairwells when I needed to go up the upper floors, and walk all over the place in that hospital, and park in the hinterlands when I go to the parking lot to go into the hospital. I would just stay active in addition to my regular workouts. That being said, my knee just had me excruciating pain, and went to see the orthopedic surgeon that had repaired my shoulder the first time I came back from Iraq. And he told me, John Bojeskill told me, he examined and said, I think I know what's wrong, Skip, but we're going to get an MRI and just verify it. We reviewed the MRI and said, you're going to need surgery. PT is not going to correct this. He said, okay, let's schedule it around Christmas time so I have time to let it recover. So once again, disruption to your normal routine, your exercise, all of this.
In addition to the things that were going on with your gums and your mouth.
Right. So that happened in, September. So that made things worse. Now you get to December, and, meanwhile, the insomnia is getting progressively worse, and it's impacting my mood and all of this. You get to December, surgery goes great until maybe 36 hours after surgery, and I am having this excruciating pain, the worst pain I've ever had in my life. And at every turn I couldn't get comfortable in any direction, just the slightest movement of my leg, and I'm having this burning, radiating pain up into my thigh, and I just can't get comfortable. And I told my wife, Sherry, I don't know if I have a deep vein thrombosis, a clot in the larger veins in my leg, or what's going on. So I said, we better go to the emergency room. So she loads me up. We hobble out to the car. There's just torture going out the car, getting into the car. Go to the emergency room. It's not a clot. Doctor says, maybe you're just exercising too much. So hobble back out to the car, back home. He had given me some muscle relaxant. Didn't do a thing. Next day, I call my surgeon, who's at a conference in Colorado Springs, and say, John, I think I may have what's called regional pain syndrome, which is a horrible complication of trauma, which surgery can be. But if you don't treat it, quickly and promptly can turn into a very severe chronic pain syndrome.
Oh.
He concurred, and he said, well, I need to get you to see the physical medicine rehabilitation doctor, commonly called a physiatrist, which you may be familiar with.
Yeah.
So I call her, and it's about 4:15 in the afternoon, and she says, oh, you wouldn't happen to be in the hospital right now? And I said, no, I'm at home, Mary Ellen. She goes, oh, see me first thing in the morning. I said, okay. So hope and help was on the horizon. Another miserable night. I go to her there. Long story short, she puts me on medications. 24 hours later, it's like first time in a week that I'm halfway comfortable. I told her later, Mary Ellen, if you had been sitting on the couch with me there next to me, I would have given you a great big kiss, because I, that pain was relieved, that headache that I had, that low grade nausea just finally was abated, and comfortable for the first time in over a week.
Yeah.
But then it was the slow recovery with the knee. And again, everything's disrupted.
Yeah.
Further impacting my mood and my sleep. And right before Christmas time, I told Sherry, and around Christmas time, New Year's time in there, I told her I am absolutely just utterly exhausted. Just my spirit, soul, and body. I am just, everything in me is just exhausted. Those were my words. I am just absolutely exhausted.
Yeah.
And and then I felt a little uptick in January, and then everything just started to go down and down and down and down.
So sinking into that depression, is that what you're saying?
Right. It just got worse and worse and worse from there. And then finally April hit the nadir. I was at rock bottom. And that's where I went to work that day and ended up crawling under the desk.
Yeah. Wow. So fighting off those different, dealing with the mouth and the gum pain and the, surgery stuff from that, and the knee pain, and not being able to alleviate some of that anxiety through exercise, that really took a toll on your mental health, as well as the great responsibility that you had in your job managing this whole hospital. It sounds like it was just the perfect storm to cause that depression that you had.
Right. And depression brings so many other symptoms, Jessica, the lack of motivation, the insomnia, as I said, the guilt, shame, these horrendous, what we call ruminations. So these negative thoughts that play over in your mind, like this relentless takes. Think of a cow, ruminating on its food. It brings it up and chews it. And, over and over there, it's these negative thoughts that play over in your mind. You're a fake. You don't deserve to be a camp colonel. You're a failure. You've let everybody down. You've let the army down.
Yeah.
Over and over and over, they just play. And then it's one thing when you have some of the distractions of the day, then you climb into bed at night, and these things are just amplified, and then you're up and down all night long, just to the point where it got that I would have longed for just 1 to 2 hours of uninterrupted sleep.
And that greatly affects your moods, not getting enough sleep. And it affects so many different things.
Absolutely. And there's an adage we say in wrestling that when you're winning, nothing hurts. And when you're losing, everything hurts.
Yeah, you feel every little ache and pain. And oh my goodness. So how did you go about seeking help for this?
Well, initially I went down to my primary care clinic, and I asked when was the first available appointment with the clinical psychologist that was embedded in the clinic. And they said, well, we have an appointment early next week.
Okay.
And I thought, okay, let me book that. And I went back to my office, and I thought, no, I don't want to wait that long. So being a colonel and being a chief of my department, I picked up the phone and I called the chief of behavioral health and talked with him, explained the situation, and asked if he could get me an appointment. He booked one for that afternoon with one of his psychologists. And so that afternoon, I saw this wonderful young clinical psychologist. She did a very thorough exam, and afterwards, so she corroborated the diagnosis. And then at the end of the exam, she said, I was talking with my chief, and we both believe there's this one of our colleagues that would be very well suited to work with you. Gave me his name, Lieutenant Colonel Mike Perry, and he became my therapist.
Oh, good. And how did that process go? When did you start to feel different?
It took a matter of several weeks.
Okay.
So I began to see Mike, and we would meet weekly, and we did what's called CBT, that you may be familiar with, cognitive behavioral therapy.
Yeah.
Talk therapy, trying to change your thinking.
Yeah.
And I remember many times sitting in his office, just feeling like doo-doo.
Yeah.
Horrible, and crying. And Mike would very compassionately say, no, you're going to be better. It's going to be better. The things you're feeling and the things that your mind these things that your mind is telling you, this is not true. And let's look at the evidence. Let's look at the track record. What does the evidence really say? And he would give me assignments that I'd have to do and bring back the next week and say, all right, let's look at this.
Yeah. And so that was very helpful, that CBT, cognitive behavior therapy.
Oh, without a doubt. And he also recommended I see my primary care physician to get into a thorough evaluation, make sure there wasn't any underlying organic causes for my depression, other diseases that can be associated with depression, thyroid disease, diabetes, etc., and have a thorough evaluation. So I saw her, and she did an evaluation, and afterwards we talked, and she said, Mondragon, there's nothing else that's going on, but certainly you're depressed, and I think you should be on some medication. What do you think? And I said, yes, I agree.
And how was the medication for you? How did that affect you?
Well, that's interesting. It initially so it boosted my mood there, and certainly helped that process. So with that and the CBT, and then sleep was the other thing that would remain problematic.
Okay.
They put me on a medication. It wasn't a benzodiazepine, which is oftentimes used, which is wasn't a zolpidem or anything like this. It was a medication called trazodone. And that seemed to, the first time I took it and slept soundly for about 8 hours. And it was like, oh my gosh.
This is what it feels.
This feels like to get a good night's sleep once again. It was amazing. It was absolutely amazing. And with that, but there was one other thing in the midst of all of this that was really crucial, and where my story hinges on was I was still struggling, and that was about 6 to 8 weeks into my struggle. And my prayers have really been up to this point, Lord, 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 please deliver me from this darkness. I just, throughout this time, I just, when you're suffering like this, that's all you want is to come out of this suffering. My brother, my youngest brother, he called me. He had been a Bible study with Franklin Graham, who talked about suffering. And in short, he talked about the horrendous suffering of Christ on the cross, and how and Christ suffered so severely on our behalf. Why should we feel as Christians that we are exempt from suffering?
Yeah.
And up reminding me of a scripture, Philippians 4:13. Oh, that I might know him and the power of his resurrection and the fellowship of his sufferings. And I began to ponder that and think
Yeah.
about it. I had prayed that scripture.
And that helped. So your spirituality, like your connection with God, the medicine that they've given you,
Right,
that really helped put you on the path towards recovery from
right,
depression. And
right,
maybe, yeah, a little bit of that anxiety was alleviated as well.
right. Because that call and that discussion with my brother and remembering that scripture changed my prayers over the next 2 days to, rather than Lord, deliver me from this darkness, please, to Lord, what might I learn and how might I use it to help others?
And tell me, how are you using this experience to help others?
How am I using it? Well, I began to jot notes and make mental notes and literal notes with the idea I'm going to share this experience with others. I'm going to see what lessons I have learned along the way and share those.
Yeah.
Before I left the Army in 2014, I shared with the hospital staff on 2 occasions what my experience with
Yeah.
depression and the lessons I learned, and admonished others who were struggling. Please don't let the stigma, your concerns with what others think, get in the way. Go get help if you're struggling. And then I made some public service announcements with the Army to talk about stigma related to mental illness, suicide prevention, and share a little bit about my story.
That's wonderful. And do you feel like the military culture is as one of the reasons people don't seek help for mental health challenges?
Well, it's a macho culture. We're tough. We're soldiers.
Yeah.
Army one. Be all you can be. And it certainly was an impediment to me because I'm a tough guy. I'm a soldier. I'm a physician. I'm a wrestler. I'm a national wrestling champ. I mean, I'm a tough guy.
Yeah.
So tough guys. And now I tell people, even tough guys get depressed.
Yep.
And beyond that, I've written a book entitled Wrestling Depression Is Not For Wimps. And it's for men. And I talk about my story. And I've written it with 3 primary aims: to decrease the stigma related to mental illness, to encourage men who are struggling with mental illness to go get help, and offer them practical tips, tactics, and techniques to help them in their recovery from depression. And it's written in layman's terms, short, easy to read chapters, and to be put into practice today.
Nice. And how are you feeling now? From
Now I
Yeah.
feel good. I still under treatment and will be indefinitely, but I feel good. I feel very well. Yes.
Good. Good. And it
Very.
helps you feel good by giving back to others, it sounds like, through your book
Oh,
and through public
without it,
speaking. Yeah.
without it, absolutely. And I love sharing my story. I feel compelled to share my story.
Yeah. And what would you tell other service members that are men, or even civilians or veterans, any population that's a male and they have depression, they think they may have depression?
Don't suffer one more day in silence. Go get help.
That's very good advice. And so I will have all your information about your book in the show notes. And how can people get in touch with you?
I have a website, www.wrestlingisnotforwimps, all one word. Wrestling is not for wimps. And the title of my book again is Wrestling Depression is Not for Wimps.
Well, thank you so much for your time today. It was really inspiring to hear your story and to have someone open up who's been in the medical profession, that's been in the military, that is a tough guy, talk about depression. So this has been very enlightening.
Thank you, Jessica. It's been my delight. I so appreciate your time.
You've been listening to Catalyst for Change, and my name is Jessica Huckabee, your host. Join us next week for another story of resiliency. And please subscribe wherever you listen to your podcasts, and feel free to leave me a comment or email me at catalystforchange20@gmail.com, or on Facebook, we have a page at Catalyst for Change Resiliency.